Welcome back to Open Line, talking with Linda O'Neill with the Tennessee Commission on Children and Youth. The new study out. You probably have seen it discussed in the news. We're going more in depth, talking about the health of our children, the well-being of our children. And as we went to break, we were talking about the notion of toxic stress. That some of the indicators, the economic well-being indicators, 1 in 3 living in a family where the head of household doesn't have a stable job, or 1 in 4 living in poverty.
Right.
This brings on stress that has real consequences. So what's being done to address that issue?
So in Tennessee, there's a substantial effort underway to try to prevent adverse childhood experiences when possible and to wrap services and supports around families when they can't be prevented. And this really began in earnest last fall with a summit where Governor Haslam and the First Lady and Deputy Governor Jim Henry brought together people to learn more about adverse childhood experiences and how we need to respond to that in more effective ways to improve outcomes for children. There is a foundation in Memphis that's called the ACE Awareness Foundation that has been really working to identify and help the community understand the importance of addressing these issues in Memphis, where there are high instances of ACEs. And they really got into that because the foundation had been involved in efforts to improve outcomes in schools. And what they really came to realize is that the children who had suffered from adverse childhood experiences, poverty, community violence, all of those kinds of things, were, in spite of having the best teaching methods and excellent teachers, they still were unable to meet academic benchmarks. It's really because, as I mentioned earlier, the cognitive, social, and emotional learning is so intertwined. They're like the different fibers in a rope, and if one of those 3 is weak, they all have to be strong and supportive, of the rope itself is not strong. And so they really got to recognizing that if we don't focus on helping prevent these experiences and helping the adults who interact with children understand the impact they have on them and respond to them in more appropriate ways, to acknowledge the pain those children have and help them develop better coping skills and move beyond it. So that's kind of where it began. And then since then, there has been an effort to really expand the knowledge of more Tennesseans about the impact of adverse childhood experiences. And one of the things that happened in the General Assembly this year, the governor included in his last budget some funding to try to better prevent and respond to adverse childhood experiences. So there will be some, it's $1 million, $1.2 million, that will be distributed through an announcement of funds in the next few weeks that will be really to help agencies, communities try to implement some creative solutions to help children move beyond those, to help parents understand the impact.
I'm glad it's being addressed, because again, as I said, it makes sense. But what is the age that we're talking about, and is there a point of no return? Could you be in a situation for 5 years where there's just horrible stress for whatever reason? Your parents are using drugs or unemployed, or horrible stress putting the pressure on your body, your brain, all those things. And at that point, do we know? Can you recover from that?
You can recover from it. What we do know is that the worst damage, the most damage, is done really in the first 3 years. But the brain is very plastic, and there are different times when it is especially susceptible to changing, to improvements, and those really peak in adolescence. And so we know, that you can do interventions later, and it's kind of like I mentioned, brain development is kind of like building a house. You have to do it right, but like building a house, you can remodel later and make other adjustments. And the other piece, though, is even adults who have had adverse childhood experiences, as they kind of understand the impact that's had on them, it helps them to realize, oh, it's not that I'm bad, or it's not that I'm a problem. It's part of what's happened to me, and I don't want that same thing to happen to my children, even though I may have already inflicted some of these on them by wrapping safe, stable, nurturing support around them. They can recover from it and not have lifelong consequences.
Let's go to Dr. Harrison on the phone. Hello, Dr. Harrison.
Hello.
Hi, go right ahead.
Yes, my question is, if a child is living in an environment where he or she is being, should I say, emotionally abused by a parent, verbally abused, and have just gone, and maybe physically abused at some point, and have gone through that when as a younger child, and when they get to be 15, 16 years of age, they are under a toxic stress, as she called it, and then they rebel back at that parent because they couldn't do something they couldn't help themselves when they were younger, and it bears on their schoolwork.
Right.
Absolutely it does, and it really, what you've described is why it's so important that schools be more sensitive and the teachers better understand the impact of trauma, that pediatricians, that everybody who encounters a child, that we have supportive kind of environments in community centers and parks and recreation and libraries where children can feel safe and nurtured. Even when there's conflict with the parent, if there's a safe, stable, nurturing relationship with someone else, with the coach, with the mentor, with the big brother, big sister, with Sunday school teacher, with the neighbor, it can help them overcome that.
It's essentially a place where they can go and feel safe, and the stress level comes down.
Right.
Where they feel those things. So you said money's been put aside in the state budget. What sorts of things will the state do to help this situation?
So among the things that need to happen is better understanding on the part of service providers, whether it's teachers or child protective service workers or probation officers or whatever. So some of the money will help support some training. And the summit in November, the participants who were there from Alberta, Canada, which has done a lot of work like this on a province-wide basis, as we're trying to do in Tennessee, really emphasized the importance of training your frontline staff so they understand the impact and they can respond appropriately. But some of the money will be used for really creative solutions in communities, and there's a lot of flexibility for agencies and groups to come together and figure out how can we make the most difference in our community. We already know programs like quality home visiting, like some of the parent education classes and all, can really make a tremendous difference.
See, Dr. Harrison, you're still there. Did that answer your question?
Yes, sir, it did. I just wanted to know that I knew that would let them not be able to focus on their schoolwork, having that environment at home and not having a happy, safe home.
Right, right. Well, that's kind of a new big area. Thank you for your call. And so, are you optimistic? You've done this. You put this report together year after year. You've seen some of the biggest problems facing kids just over and over again. I'm sure you've seen successes. You must feel some frustration in some areas. But overall, how do you feel about where we're going?
So I am very optimistic that the emphasis on preventing and responding appropriately to adverse childhood experiences has, and doing that in a variety of ways that clearly make a difference, has incredible potential to improve outcomes for children in Tennessee, to improve parental outcomes. I think that as a state, we are good at coming up with creative solutions. We have a limited state budget. We are a low-tax state, and yet we often have better public policies than some other states do. And so as we really come together and learn more about how important it is that we help children recover from toxic stress, prevent it when we can, that we will improve outcomes for children. Is it a quick fix? No, but none of the others are either. I really believe this has the most potential to improve long-term outcomes in Tennessee of anything I've seen, and I have been around a while.
So that is interesting. So when I ask you about whether you go back again to this notion of toxic stress, how old is that? Is that 5 years, 10 years? I mean, how long have we really been focused on that? 1 year?
The research really came out about 20 years ago, and so the time frame it often takes in social sciences to implement what research begins to make known is generally much longer than that. So it's been about 20 years since it first came out, and in this state for the last several years there have been increasing efforts to focus on it. The Commission Commission on Children and Youth has provided learning opportunities through our regional councils all across the state, so more people will know about toxic stress and how they can respond more effectively to it. The Department of Health has added to surveys about health outcomes in Tennessee, questions about toxic stress. So by the fall, we'll have Tennessee data that's reliable data about the prevalence of adverse childhood experiences in Tennessee, and really be able to better target what those experiences have been and how we can better provide the services and supports that lead to recovery.
Let's go back to the phones. Hello, Bob.
Oh, howdy. I think that the LIFA programs are good ideas. To me, the problem is it's all over the basics, and to be thrifty. I also, in this day of, high celebrity, and I hate to say the mess they are, that's hard to do.
Okay.
And,
so you're talking about our culture, our overall culture.
Well, yeah.
All right. All right, Bob, thank you.
Yeah.
Concerns there from Bob about the culture. I don't know how you, but does that, what do you say to that?
Well, I think in part we have to work on changing the culture in Tennessee, particularly in terms of the way we respond to this issue for preventing adverse childhood experiences and for helping people recover from them. And one of the things I would note, though, is there has been a lot of emphasis over probably 20 years now in preventing child sexual abuse, and that actually has declined nationally across the board. And in Tennessee, we have had an impact on reducing child sexual abuse, and that's it really is an area that shows when you make concerted efforts, you can prevent and you can improve outcomes. And prevention is always tricky, because how do you measure something that didn't happen? But there are ways, again, to look at things like the surveys where we find out from adults. Over time, we'll see if we reduce some of those outcomes.
Well, that's good to hear, because you hear a horrible situation like that on the news, and you just feel like, everything is messed up and horrible. It's good to know that there is a decline.
Yes.
Because, and I guess what helps there be a decline is by shining light on it.
Right.
By a report like this. And I tell people, by putting it out there, it can be depressing and feel overwhelming, but at the same time it is a call to action, and it can lead to some positive things.
It is a call to action. It shows us where we've made progress, and it highlights where there's still challenges. I think one other thing I would mention, where there's been a lot of improvement that people don't really see, and it's not measured in the kids count, this kids count report, but it is a part of the negative outcomes that often happen when children don't get what they need, and that's that juvenile delinquency has declined substantially in this country. It peaked in the 1990s and has gone down since then, but people aren't always aware of that, because when kids do things that are horrible, and it's horrible that they do that, that's all over the news, but the good things that are happening, and so that's why I'm really happy to say in this that while we still need improvement, we have lower adolescent substance abuse and lower teen births, and we have more adolescents who are graduating high school on time.
It's
so
important
those
to
are
point
good
that
things.
out. Yeah, in the 90s, we were going to have a wave of
Super predators.
Disastrous kids.
Right.
And we haven't seen that.
That did not only have we not seen the wave of super predators, we have overall in this country seen substantial reductions in juvenile delinquency, and a part of that has been accompanied by using more what gets referred to as evidence-based programs, by using more therapeutic and less punitive programs that really help young people develop the skills they need to deal with anger that's often the result of toxic stress, to learn appropriate pro-social behavior that they may not have experienced, and we've really seen some positive outcomes in that area.
All right, we'll take a break. We'll come back. If you want to call, there is the phone number. We have one more long segment where you can call in, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.